a quick summary, which is impossible. The things that I've heard anyway that have stayed sort of in my mind as the summary. First, I really did think that Cal laid some very important things out at the beginning. Beware of innovating in silos. Partnerships are essential. Ecosystems must be the focus. Beware of innovating at the scale of the underlying industry. I thought that was a particularly good one. Solve for interoperability and build solutions into the clinician workflow. And I think that is also exceedingly important. Unlock the real-time data from digital solutions so that we can inform care in real time in practical ways. The promise of cloud-based algorithms to inform things like dose guidance to drive compliance, I think is a great example of that, and I thought it was very important. We talked a lot about the role of the CIO and how the CIO is moving now and evolving from being a cost center to actually a revenue enabler, and how the CIO role has to work in terms of educating and engaging internal stakeholders to change the perception of what the IT capability really is all about. We struggled with the question of when do you know when to build and when to buy. And I think the answer was clear that it's not one size fits all, but you've got to know that sometimes you've just got to go ahead and buy, but you've got to know what you're buying. Sometimes you have things in-house. The importance of developing innovative algorithms or software solutions to enhance biopharma or medtech core products can be and should be differentiating. And so the notion of, again, how do you differentiate what you're doing from your competitors? The challenge, developing and scaling these health solutions that protects privacy and security, especially not only nationally but globally. We talked about the emerging role of the patient, and we talked a lot around when the patient versus a consumer, a person. But that clearly the tools must engage the individual, and we spent a lot of time on that today. Life science companies have had a conservative approach to digital innovation, and a lot of smaller, more nimble startups have taken the lead in developing novel digital therapeutics and combination products. A lot of that was because of the regulatory environment. And biopharma companies, we really got some very sober advice around the notion that the FDA is very often not your friend, particularly if you are a big biopharma. And maybe some of this makes sense that you partner with smaller ones and allow them to be able to take the innovative risks and move the ball forward, and then you benefit if you are larger from that. The significant regulatory investment in developing new digital tools is something that requires sober business judgment. The full potential of digital health, however, will not be realized until biopharma and medtech companies move beyond simple apps to sophisticated digital health solutions like digital therapies, artificial pancreas systems, infusion pumps, anticoagulation systems, and others. And so there's got to be a sense, and I know I struggle with the questions that I asked around at what point do you have a world where the FDA creates such a disincentive to engage at the level in which the health system and people need innovation, but because of the fear of that, you try to fly below the radar and try to do non-medical level stuff. There was not a lot of encouragement about how the FDA is going to move on that, especially since Scott has gone from there and we don't know who the new person will be. I think this is an agenda that I'm going to take on outside of your world, as others of us who are, sometimes I have certain things I do in the political environment that we've got to find a way to work with and I get to talk to some of the HHS leadership on a regular basis, and I'm going to add this to my portfolio personally because I really was concerned by the answer. But the answer I thought was great. I mean, the answer was smart and thoughtful and experienced, but it's a suboptimal answer if we want the healthcare system for America to be what we want it to be, and this just can't continue. So I just found myself very motivated about that. I was when I went from depression, I went to excitement by the comments from BrightInsight in terms of how they are trying to serve as the leading edge of the wave and allow other people to bring their boats behind you. And I thought that was a terrific thing, and I appreciated BrightInsight's willingness to take that on behalf of their customers. When will digital health scale? The key will be in engaging patients and providers. Digital health partnerships will be challenging but essential. And then finally at the end, we really did, I think, really hear very clear guidance around biopharma companies must be able to now work beyond the molecule and have the wraparound services. And I thought that Cal's last words were very, very, very spot on. That, and I think he made an easy bet. Inevitably, the digital side and the molecular development side are going to be smashed together, and they will operate as one. It has been an incredible day. I can't believe this audience. You all have been, I mean, attentive, focused, energetic. You're terrific. And so there's going to be somebody from BrightInsight who's going to come and talk about a tour, which I have no knowledge about. And I wish you all a good day.